Welcome to the Lake Travis Biz Report and our What's Up Wednesday segment. I'm Mike Paul, your host. I'd like to welcome Dr. Chad Denman from Sleep Cycle Centers. Welcome.
Thank you so much for having me.
It's our pleasure. So I want to ask you some questions because what you do is really fascinating, and from just personal experience, having gone through some sleep issues over the years, I find this topic to be really helpful, and I think a lot of the people in the community who suffer from various ailments, related to sleep and health, I think will find this information to really be very important. I wanted to talk to you about your background and how you actually formed Sleep Cycle Centers. What gave you that motivation? So first of all, you are a dentist by background, correct?
I am. Yes, I've been a dentist in the Austin area for a little over 15 years. Moved here by way of Florida after college, and have started 5 offices from scratch and sold them all off. About 5 years ago, something real tragic happened in my family. We lost my dad to undiagnosed, untreated sleep apnea, and it was it's a very hard thing to go through, and it really did rock my family to the core. And so, you can always start out that conversation or that thought process with, blaming healthcare, blaming the doctor, just blaming my dad just for not getting the help that he needed. But he did go to the doctor. He did do his yearly physicals. He did everything he needed to do, in my opinion. And so playing the blame game doesn't do anybody any good. So actually figuring out what happened and how we can prevent that from happening to other families. And so that was my hobby mission while I was finishing up my commitment in dentistry. I opened our first office about 5 years ago, part-time, 1 day a week, and it's blossomed into 2 locations full-time. We're bringing on a couple of more providers. And what's interesting about what we're doing is we're providing options to patients that do suffer from any type of sleep ailment. The biggest one, of course, that we all know of is sleep apnea. And we're going to talk about a little bit about that today.
Absolutely. Okay. So let's jump in and start talking about sleep apnea, because I know that was something that your father had suffered with. And for those that really don't understand kind of what sleep apnea is and maybe how that differs from snoring, maybe to explain a little bit about, what is sleep apnea and what is that difference?
Yeah, so oftentimes there's a lot of different warning signs for people that have sleep apnea that don't know it. And it normally presents itself with, like you said, snoring. And so when that transition happens from just making a noise in the middle of the night to actually having sleep apnea is kind of a gray area for most of our population. And so ultimately, how it presents itself in the body is we're tired all the time. You need caffeine throughout the whole day, several cups, or after lunch, you need a nap.
Got to have that afternoon cup of coffee, right?
Absolutely.
or more.
Or more, yes. And so when you start listening to your body, and one sign is getting up to urinate in the middle of the night, most people don't have to do that. And so if that's happened to you more than once a night, if you have acid reflux, there's lots of different clues that the body is presenting itself. Maybe you just got on medication for the first time, and it's high blood pressure medicine or high cholesterol medication. And it can be your hormones that are out of whack. When you have sleep apnea, your cortisol levels go way out of pace with the rest of your body, and it causes a lot of damage to happen.
Wow. So, how does one know whether you have sleep apnea? I mean, is there are the symptoms pretty clear? Are there tests that one can do to figure out, whether or not this is something they actually have? So how does that all work?
Yeah. Well, thanks for asking that. The one thing that we figured out when we first started this company is there really wasn't a screening tool that many doctors knew about. And so discerning that and being able to pick up which part of the population has sleep apnea was really important to me. There's a screener that we use. It's on our website, www.sleepcyclecenters.com. It's free of charge. You fill it out. It's 21 questions, and it's 92% accurate at identifying who has sleep apnea, even without a test. And so why do doctors check for blood pressure? It's a screening tool. And so that's what we have that put together along with this test. It's disposable. It's called the WatchPat 1. It's, if I'm opening it up, it's as simple as wearing a watch in the middle of the night. And so if you look at it.
Pretty cool. Because I remember I went through a sleep test many, many years ago, and I was wired up. I mean, I had wires and cables hanging from me all night long, and I'm thinking, how am I ever going to fall asleep with all this on? So we've come a long way, haven't we, from those kind of tests?
We have. So this is 90% of the same information that you get in an in-lab study. So, and for a tenth of the cost. I mean, most in-lab studies, sleeps for one night starts off at $2,000 depending on the test and goes up to $6,000. And so these are pretty inexpensive. It's a watch that you wear that has a finger monitor and then one little sternal lead that connects just below your sternum.
And so it records everything that's happening to you during the middle of the night. And then is that transmitted up to some location for evaluation, or how does that work?
Yeah, no, you're asking all the right questions. So
I'm a techie kind of guy. I got to know how this works.
So this works with any smartphone. Where we are, we're away from flip phones now, and most people, we haven't found too many people without them. There are other tests if you don't have a smartphone, but typically this will sync up with an app. The app, you press start, it'll show you a video on how to put it on. You wear it throughout the night, you wake up, you press finish, and all that data gets sent to the cloud. And the cloud information automatically goes to our board certified sleep physician that interprets that test, gives her treatment recommendations. And then you meet with me and we talk about those and decide what form of treatment is best for you.
Okay, so let's explore that a little bit. So somebody comes in, they're having some sleep disorders, they go through the test, they determine that there is some level of sleep apnea. And are there different levels of severity too? Is that something that, that I guess that would weigh into how you would treat? But what would be, what would be the next step? I mean, is surgery the only option? Are there other options for people that say, hey, you know what, I have an issue here, what do I do about it?
Sure. So there's several different forms of treatment. We call them treatment modalities when it comes to treating sleep apnea. The first one everyone probably knows about. It's a CPAP. It's a mask that you wear at night, and it forces air up your nose and down your throat. It keeps the airway open. I always describe it like a garden hose. You can't kink the hose if you have pressure going through it all the time. The next one would be an oral device. There's actually a device that you wear that's top and bottom. And what it does is it keeps the distance between your teeth apart, which keeps the space between your tongue and your palate separated. And so oftentimes when we sleep and we snore, the tongue will fall back in the middle of the night. The soft palate will droop down when you snore, and you'll have periods of time where those completely close off the airway. Well, if we're able to keep that from happening, and we're able to keep that lower jaw from falling back in the middle of the night, then the tongue can't block the airway, and neither can the soft palate.
So would that be similar to like wearing a night guard? I know, a dentist might put that in if you tend to grind your teeth at night, or you're having those types of issues. So it's just something that you put in at night and take out, and it's just okay.
And everyone has a sweet spot, if you will, where that vertical dimension and that horizontal dimension is perfect, and we need the capability, unlike a night guard, in order to move that. Okay. And so I get this question a lot, so I'll go ahead and answer it. It isn't something that's billable through dental insurance, because it is what we're putting in your mouth is FDA approved to treat sleep apnea from a medical perspective.
Okay. So yeah, that definitely was one of my questions is this covered by most medical plans, or and so it would be a medical procedure as opposed to a dental procedure. So,
absolutely.
Okay, terrific.
And so we were looking at options. Countrywide, if we had to put a number on how many people we're treating sleep apnea and the people we're identifying, we're really focusing on less than 10% of the population that we're even identifying, and only 1% of the people are getting the help that they need, oftentimes because they're scared of what the treatment might be, because it's surgery, it's a CPAP.
Yeah.
A lot of people haven't heard about the oral device. And in other countries, that's 50 to 60% of the people that are being treated for sleep apnea are getting an oral device as opposed to the others.
Yeah, I wanted to go back to ask you a question that I was thinking about is, how big of a problem is sleep apnea actually in the general public? I mean, do you have any kind of studies to say what percentage of people suffer from some form of sleep apnea?
Absolutely. So from birth to death as of 5 years ago. So it's worse now, of course, and I'll explain the reason why here in a minute, but it's a third of the population.
Wow.
And so we need doctors' help. We need dentists' help. We need chiropractors. We need people that are doing the screening in order to help move that needle, because treating 1% of the population is not helping anybody. It's identifying the people that are the worst, the most severe. If we catch it early, it's a lot easier to treat, and then those people don't have the lifelong medical problems that go along with it.
So, and I think, there are probably many reasons why this this has become such a medical crisis, I think, in the country, and I know all of us we just have gone through this COVID pandemic year, and many have gained a few pounds perhaps
Absolutely.
along the way. I think that's one issue I believe that can make a sleep apnea condition worse.
Yeah, what they're saying is to date, for people that have an extra 40 or 50 pounds, it can mean the difference between whether you're mild, moderate, severe, or chronically severe,
So another good reason to eat healthier and maintain a healthy weight, right?
That's right.
It helps along that line as well. So you mentioned the different types of treatments, and so what's involved if somebody were diagnosed with sleep apnea, and then you would discuss with them through consultation on what kind of treatment would be most effective for them, and then what's the next step? I mean, what would they do? How long does it take to develop that treatment and for starting to see some results from that?
Sure. Oftentimes, depending on the treatment modality that is chosen, within 4 weeks they can have their oral device. Within a week they can get the CPAP. For the surgery, we're at the surgeons, back and calling when they have the availability. But what that looks like for most people is, they've been tired for years and they haven't really paid attention to it. And majority of your 30, 40-year-olds just think it's them getting older, and 30s and 40s and 50s and 60s, those are your prime years, and you shouldn't feel run down and no energy and tired all the time. Maybe when you're 90 years old, but it doesn't have to happen that early.
Yeah. So, and I think a lot of people don't really understand that connection. It's just because we all, it's no longer a 9-to-5 society. I mean, those of us that have been in the entrepreneur field know that you're really working 24 hours a day to some extent, or you're thinking about it at night too. So sometimes it's hard to identify, I guess, what is just maybe too much on your mind as to maybe is there a real problem, but going through the testing and consultation is one way to determine whether or not this is something they really need to address, and that. I think that's certainly a valuable thing. Let me talk about the sleep cycle centers a little bit. So you founded Sleep Cycle Center. You got 2 locations you mentioned. What is your vision for what would you like to see over the next few years? Within your own practice.
Sure. We're pivoting ourselves pretty strongly to open at least 1 per year moving forward for the next 5 years. We want to cover most of Central Texas. And then ultimately we'll make a choice at that point in time on where it goes from there. Wholeheartedly, I would love for there to be a sleep cycle center in every single community in the entire country. And I do believe that it's needed.
And how do people? How do you get your message out? What type of approach are you looking at in order to spread the message? Do you work with other doctors or other professionals out in the community?
I do. There's a lot of pounding of the pavement over the years, if you can imagine. Going door to door, different doctors, and it really does take a full community effort. and that's why we're talking today. You know, it's not just medical doctors. It's your cardiologist, your chiropractor, your endocrinologist, your dietitian. Anybody that treats anybody for any ailment at all should really pay attention to this. We spend a third of our life in bed for a reason. And if we're not spending those, non-waking hours healing and for the body repairing itself, then we're not here as long as we could. Much like my father that passed away at the age of 60.
Right, I know, and that's tragic. So if someone wanted to get a hold of you, you have a website, which is
www.sleepcyclecenters.com.
Okay, great. And of course, they can also call you, and we'll have the phone number and contact information up on this video if people wanted to reach you. And and you mentioned there's a screener on the website itself, so you can get that first initial evaluation, and then the next step would be to utilize the kit, right?
If the screener's positive, you'll be asked, and these get mailed out to your home, so it's not even something you have to come in for. We meet all of our patients virtually as well to go over their results through our platform EMR program, electronic medical record. And so patients get to meet with the board-certified sleep physician through there, get to meet me through there. And then when we need to see each other in person is when it comes to the treatment part, if there is at all. I mean, we do meet with several people that they find out that their best bed position would be to sleep in this for the most restful night's sleep. They might find out that they don't have sleep apnea, that they actually have other things they need to work on. And so it takes us on a whole different path.
I'll tell you, getting a restful night's sleep is so important, and those of us that have gone through this, understand the difference between being tired and getting restful sleep, and really what that can do for your overall health. So I think that's probably the big takeaway here, is that is really that resolving the issue, the underlying issue, can make huge differences, in your overall health.
And I think by my dad passing away, I found out that I have sleep apnea, and I was in the moderate category. And I wasn't listening to all the signs and symptoms. I got tested just like everyone else. I wear an oral device every night. I tried a CPAP. It did not work for me. And so we do like to give options, and we like the patients to pick the treatment because they're more successful if they are part of the program.
So any final thoughts, or something that you found that's important, maybe that you get a chance to mention?
Yeah, I think just thinking about every family member that you have, every loved one, friends, neighbors, relatives, whoever they might be, if they do snore in the middle of the night, or if they feel tired at any point in time, send them to our website. It is free for them to do the screener, and at least it starts the process. And those people, within 24 hours, they'll get a response back from us on whether or not they were positive or not.
Thank you again, Dr. Denman, for coming in. And this is such an important issue, a health issue out in our community. And so really appreciate all the great information, and hope that, if you're a person out there and you feel that this may be impacting you, that you take that measure, go out, get checked out, go to the site, and determine whether this is something that needs to be treated. It can really make a huge difference in your life. So thanks again for coming in.
Thanks so much for having me.